Hey, this is Dr. Paul Firnhaber again with 10 Minutes of Truth. So this week, we're going to talk about an article that came out in the British Medical Journal Open, March 31st of this year. And this is a really, really important article, at least in my opinion, but I think it will be in yours also. The name of this article, it's kind of a long, complicated name, but I'll explain what they're talking about here in just a minute. It says association of kyphotic posture with loss of independence and mortality in a community-based prospective cohort study, the locomotive syndrome and health outcomes in AZU cohort study. Now, this is a study that was actually done in Japan. It was done with 1,621 adults greater than or equal to 65 years old. So it's basically people 65 and over. And basically, what the article is looking at is they were studying when somebody develops a kyphotic posture, meaning their head is starting to come forward as well as their thoracic spine. So they're having this forward lean when you look at them from the side. Does that affect their health? Does that affect their longevity? And how does it affect them? Well, they found out that this has a major effect on not only health, but locomotion and just the ability to live a normal life. Now, the article states that 20 to 40% of older adults have a kyphotic posture. And there's been a growing concern that there's association between kyphotic posture and serious health-related outcomes such as loss of independence. Now, when you develop a kyphotic posture, one of the things that happens is that as your body leans forward, your entire spine compensates in a way that's unhealthy. And not only that, structural changes in the not only do you see structural changes in the vertebral column, but back extensor muscles become weak. Now, there's a test that you can do to test yourself for kyphotic posture. It's called the wall occiput test. And basically, it goes like this. If you stand up against the wall with your rear end, your sacrum, and your heels against the wall, and you look and you level your head, and you measure the back of your skull, the occiput, to the wall, anything less than 4 centimeters would be a mild kyphosis. Greater than 0, less than 4 centimeters. That's about an inch and a half. Severe kyphosis would be greater than 4 centimeters or greater than an inch and a half. Now, here's the interesting thing. If you look at a mild kyphosis, which is less than 1.5 inches from the back of your head to the wall, you have a 17% increase in mortality and a 70% increase in loss of independence. For a severe kyphosis, and in Japan, in this study, 17% had mild kyphosis, 12% had severe kyphosis. In the severe kyphosis group, you have a 99% increase in mortality and 108% increase in loss of independence. So some of the bad effects of a kyphotic posture on health include decline in physical function, impairment in pulmonary function. I'm going to talk about that more in a minute. Increased pain, gastroesophageal reflux, poor quality of life, and increase in falls. Now let's just talk about impairment in pulmonary function. So one of the ways that you can test this is just to sit up straight in a chair. Take a few breaths in. Now lean, bring your head forward like this. Now breathe in and out and see the difference in how much more difficult it is to take air into your lungs. So that would show you how a forward lean or forward head posture could affect lung function. Now, what about increased pain? Well, here's another little exercise you can do. Sit up straight in a chair, put your thumbs into your lower lumbar muscles, and then lean forward like this and feel what happens to those muscles in your lower back as your head and upper body go forward. You can feel them tightening up and getting stressed. So those are two ways that will show you how a forward head posture, a kyphotic posture, actually affects health. Now, men with a mild kyphotic posture identified had, by the wall occipital test, had a 220% increase in mortality. I mean, that's a lot. Reports suggest that exercise may modestly improve back extensor muscle strength. So one of the exercises you can do is lay face down with your head over some stairs, going down so you have room, and then just do an extensor. Just extend your back up and hold it, then come back down, extend it and hold it. You can also do this over a Swiss ball, and that's the way that I do this exercise. The present study does not present evidence to support surgical intervention to correct kyphosis, so there's no surgery for this. And in fact, the best thing that I know is home traction exercises, which I give in my office in chiropractic care. These are some of the primary things that help a kyphotic posture. So you need to bring the head back over the shoulders, and you need chiropractic care to correct subluxation so that can happen. And I literally put almost all of my patients on home traction exercises to accomplish this. So the object of this lesson is that kyphotic posture and forward head carriage creates a lot of health problems in people. These problems can be helped or corrected with the proper home traction exercises and chiropractic care. They cannot be corrected through surgical intervention. It is not recommended. So once again, we see natural health care correcting a problem that's actually been detailed in the literature. This isn't the only study on that. I can count 1, 2, 3, 4, 5, 6, 7 other studies that show how poor posture relates to poor health. So that's all I'm going to talk about for today. If you want your posture screened, you can call our office. We do it at our expense, and we can tell you if you have a postural issue and if we can help you. Hope you have a great day. This is Dr. Firnhaber. Until next week, goodbye.